My role in the treatment of oropharyngeal cancer patients is to evaluate and treat speech and swallowing problems before, during, and after treatment. I think there's two important reasons for a patient to see a speech pathologist prior to treatment. One is to understand what could possibly happen to their swallowing during this treatment. You can have something called mucositis, where you get sores in your mouth. The radiation can cause inflammation, tenderness, swelling, which makes it very hard to swallow. You can have really thick mucus because the salivary glands are being affected by the treatment. Sometimes you don't feel like eating because of the chemotherapy you're getting. It's hard to predict specifically what's going to happen because every patient is different, every cancer is different, every tumor is different, and no two bodies react the same way. But it's important to have some idea of how the swallowing is going to be impacted during the treatment. The second really important reason to see a speech pathologist before treatment is to start exercises. Unfortunately, radiation can have effects for years after the treatment. Tissue and muscle can become hard and fibrotic. So we really work on, one, trying to prevent some of that from happening by swallowing exercises. And two, there's techniques and things we can do with our diet to make swallowing much easier. It's important to differentiate aspiration from aspiration pneumonia. Aspiration is when food or liquid go the wrong way. It turns out that the feeding tube or the esophagus is right next to the trachea or the breathing tube. So a lot has to happen in order to protect the airway from food or liquid going into it. And we all can have moments where food or liquid goes the wrong way and we start coughing. But aspiration can happen more frequently after someone has had surgery on their throat or is getting radiation or chemotherapy, and it's targeted in the swallowing mechanism. The important thing is to not develop aspiration pneumonia. That's when people become sick from having food or liquid into their lungs. People who have poor oral hygiene or have other medical issues are more at risk for developing aspiration pneumonia. Our job as swallowing experts is to make sure that we diagnose those people who are at risk for aspiration pneumonia. There are two ways for us to assess swallowing. One is called a modified barium swallow study. The modified barium swallow study is actually done with a radiologist in a radiology room where it's done under fluoroscopy. And we actually give you things to swallow, but it has barium in it so we can actually see all the structures of the swallowing mechanism. A FEES, or fiber optic endoscopic evaluation of swallowing, can be done in the clinic, in the doctor's office or the speech pathologist's office with a nasal endoscope that we put into the nose, and then we watch you swallow that way. The most important thing I can do as a speech pathologist is to tell a patient that they're going to make it through this treatment. They're going to get through this treatment, and that we're there to help them get through this treatment.